You know, when a drain gets clogged and things start backing up?
Hmm.
Well, imagine that happening inside your beloved pet, not in the sink, but in a really significant system we need to understand.
Right.
Welcome to the deep dive, where we take complex info and, well, pull out the crucial insights. Today, we're plunging into the world of portal hypertension in dogs and cats.
And for this deep dive, we've got excerpts from a pretty detailed veterinary textbook, the kind of source your own vet relies on for accurate, in-depth knowledge.
Exactly. So our mission here is to demystify portal hypertension.
Hmm.
We want to explore what triggers it, what it actually means for your furry family member, and give you some clear, maybe even surprising takeaways.
Sound good.
So let's dive right in. Portal hypertension, what exactly is going on there?
Okay, so at its core, portal hypertension is just abnormally high blood pressure, but specifically within the portal vein system.
The portal veins system.
Yeah. The technical definition, if you want it, is a portal pressure over 13 centimeters of water or 10 millimeters of mercury. But really, just think of it simply as too much pressure building up in that specific network of blood vessels.
And this portal vein system, what makes it, so susceptible to this pressure problem?
Well, what's fascinating here is the portal vein's unique job. It's like this central delivery route, right?
Okay.
It carries blood that's loaded with nutrients from the digestive organs, the spleen, the pancreas, straight to the
For
liver.
processing.
Exactly, for
Yeah.
processing. And it's designed to be a path of least resistance. But crucially, unlike a lot of other veins, it doesn't have valves.
Ah, no valve, so nothing to stop backflow.
Precisely. It lacks valves to prevent backflow.
Mm.
And that valveless nature, well, that's kind of its Achilles heel when pressure starts to climb.
Okay, I see. So if the pressure spikes, what's causing this internal traffic jam? What makes it go up?
Generally, we see two main categories of causes. Either you get an increased rush of blood into the portal system,
Okay.
or there's some kind of blockage that resists the normal flow out,
Yeah.
increased resistance.
Hmm.
And, often it can actually be a combination of both.
Okay, let's look at that increased flow first. How does the volume of blood suddenly surge like that?
Well, one way is through something called arterialization. Imagine if these normally low-pressure veins suddenly got a direct hookup to high-pressure arteries.
Whoa, okay.
It's like a sudden surge of water just overwhelming the system. These abnormal connections are called arteriovenous malformations, or AV malformations.
Right.
But increased flow can also happen kind of indirectly
Hmm.
as a consequence of increased resistance within the liver itself. That causes blood to back up and flow away from the liver.
Life emit.
Yeah, we call that hepatofugal flow. It backs up into those valveless abdominal organs we mentioned.
Hepatofugal. So the blood is basically trying to find an escape route because the main path is blocked.
That's a good way to think about it.
Now, what about the other side of the coin? Increased resistance. Where can this roadblock happen?
So think of the portal veins journey to and through the liver like a road trip. Increased resistance can be prehepatic roadblocks before the liver,
Okay.
hepatic traffic jams within the liver itself,
Right.
or post-hepatic bottlenecks after the liver, stopping the blood from getting out smoothly.
Can you give us some specific examples of these internal roadblocks? Like what actually causes them?
Sure. So for prehepatic issues, a common one is a blood clot directly in the portal vein. That's called portal vein thrombosis.
Okay, a clot.
Or the vein could just be getting squeezed from the outside, maybe by a tumor or even an inflamed pancreas, pancreatitis.
Right, pressure from the outside.
Exactly. Then within the liver, hepatic resistance, that could be caused by scarring of the liver tissue. That's liver fibrosis or cirrhosis.
The classic liver disease.
Right. Or just ongoing inflammation, chronic hepatitis, or even a congenital issue, something they're born with, called ductal plate malformation, or DPM. And then finally, post-hepatic resistance after the liver. That can happen because of things like right-sided heart failure.
Ah, the heart's involved too.
Yes, or even severe heartworm disease that affects the big vein returning blood to the heart, the vena cava.
Wow. So it really is all interconnected. A problem way over in the heart can actually cause a backup that affects the liver's blood flow.
Exactly. You can really see how a disruption in one part of the circulatory system can have these significant knock-on effects elsewhere in the body. It's all linked.
Okay, so the pressure is up. What are the immediate consequences? What happens next in the pet's body because of this portal hypertension?
Well, several pretty significant things can happen. One of the most common is the body actually developing acquired portosystemic shunts, or APSS.
Acquired shunts. So the body makes new blood vessels.
Kind of. Think of them as newly formed detour routes. Because the pressure in the portal system is so high, the blood actively seeks out alternative pathways to bypass the liver entirely.
Bypass the liver?
Yeah, and flow directly into the general circulation, usually into that big vein, the caudal vena cava. And what's really interesting here is how quickly these can develop.
How quick?
Sometimes within just 1 to 2 months of the pressure staying high. The body adapts, but not necessarily in a good way.
Wow, that's fast. Detour routes, it's like when there's a major accident on the highway and suddenly all those little side roads become completely jam-packed with traffic trying to get around it.
That's a perfect analogy. That's
Mhm.
exactly what's happening. Another major consequence is abdominal effusion, or ascites.
Ascites, that's fluid buildup, right, in the abdomen.
Correct. Fluid buildup in the abdomen. This happens because that increased pressure literally forces fluid to leak out of the blood vessels and also the lymphatic system in the area.
And I think I read somewhere that the type of fluid that builds up can actually give vets some important clues.
Yes, that's a very important point. Analyzing the fluid's composition, specifically its protein content, gives your vet really valuable clues about where the problem might be originating. It helps narrow down the cause.
How so?
Well, if it's what we call a pure transudate, very low protein, that often points towards liver issues, maybe the liver isn't making enough protein like albumin.
Coke.
But if it's a modified transudate with higher protein levels, that might suggest post-hepatic problems are more likely, like heart issues causing congestion.
Interesting. Okay, so we've got these detour shunts forming and fluid building up in the belly. What other dominoes start to fall?
Well, because those shunts let blood bypass the liver.
Right, the processing center.
Exactly.
Huh.
Toxins that the liver would normally filter out can build up in the bloodstream and then reach the brain.
Uh-oh.
Yeah, this can lead to something called hepatic encephalopathy, or HE,
Hepatic encephalopathy.
and that can show up as neurological signs, confusion, disorientation,
Yeah.
maybe just acting off, or even progressing to a stupor-like state.
Okay, that sounds serious.
It can be.
Yeah.
We can also see splenomegaly, that's an enlarged spleen, just due to all that blood congestion backing up into it.
Okay.
And then there are various gastrointestinal issues. That increased pressure can cause swelling or edema in the gut lining.
Yeah.
It can make the gut more permeable or leaky. It can even lead to bleeding, ulcers, and problems absorbing nutrients like protein.
Wow, it really sounds like a cascade of interconnected problems, all starting from that initial pressure increase in the portal vein.
It absolutely is.
Now, are some pets more likely to get this than others? Are there predispositions?
Generally speaking, yes.
Mhm.
Dogs seem to be more commonly affected by portal hypertension than cats.
Okay.
And then within dogs, there are definitely certain breeds that seem to have a higher predisposition to specific underlying causes.
Like which ones?
For example, Doberman pinschers. They're known to sometimes develop a non-cirrhotic form of portal hypertension. It's not caused by scarring.
Interesting.
Boxers seem to have a higher incidence of that ductal plate malformation, the DPM we mentioned.
Right, the congenital one.
And Bedlington Terriers, they're predisposed to copper-associated hepatopathy, a liver disease involving copper buildup, which can then lead to portal hypertension.
So, knowing your pet's breed could actually be a helpful piece of the puzzle for the vet.
It definitely can be. So while any pet can technically develop this, owners of these predisposed breeds might just need to be a little extra vigilant about certain signs.
Okay. What about age? Does that play a role?
Age can also be a factor, yes. Congenital issues, things they're born with, well, those tend to show up in younger animals, as you'd expect.
Right.
So we might see vascular malformations or maybe heart-related abnormalities causing problems in juveniles.
Okay.
On the other hand, acquired disorders, things that develop later in life, they're generally more common in middle-aged to older pets.
Makes sense.
So for instance, those blood clots in the portal vein thrombosis, that's more likely to happen in older animals, and it's often linked to some other underlying issue, like chronic inflammation in the gut.
Okay, so thinking about the owners listening, what are some of the early warning signs someone might notice at home if their pet is developing portal hypertension? What should raise a red flag?
Well, historically, one of the first things owners might notice is just a gradual enlargement of their pet's abdomen. That swelling from the ascites, the fluid buildup.
The pot belly look.
Exactly. Sometimes vague gastrointestinal signs can pop up early on, like maybe occasional bouts of bloody diarrhea. That can be a sign, especially in cases involving those portal vein blood clots.
Okay.
And then, if hepatic encephalopathy starts to develop, because of those liver shunts.
The brain signs.
Right.
Yeah.
You might observe changes in your pet's behavior. Maybe they seem more lethargic than usual, maybe a bit disoriented, or they just seem confused about their surroundings.
Right, not acting like themselves.
Exactly. And in those cases where heart problems are contributing, the post-hepatic kind, owners might notice things like coughing, especially after exertion, or just a general reduced ability to exercise. They get tired more easily.
Okay, that's helpful for owners to keep an eye out for.
Mm.
Now, what might a veterinarian find during a physical exam that would point towards portal hypertension?
Well, during the hands-on exam, probably the most common finding is that abdominal effusion, feeling the fluid wave in the belly.
Mm-hmm.
Depending on the underlying cause, the vet might also be able to palpate or feel an enlarged liver or an enlarged spleen.
Does it matter which one is enlarged?
It can give clues. An enlarged liver, hepatomegaly, is maybe more commonly felt with post-hepatic causes, like heart failure backing things up, whereas a congested, enlarged spleen, splenomegaly, can occur with various causes.
I see.
In cases linked to heart problems, the vet might also notice that the jugular veins in the neck look distended or full.
Okay.
And if the underlying cause is primarily liver disease, they might observe jaundice, that yellowish tinge to the skin, the gums, the whites of the eyes.
Right, jaundice.
And here's a surprising detail maybe. In really rare instances, specifically with those arteriovenous malformations in the liver.
The AV malformation.
Yeah. The vet might actually be able to hear a specific abnormal sound, like a whoosh, when listening to the abdomen with a stethoscope. It's called a hepatic brute.
A hepatic brute. Wow, that's a fascinating and very specific finding.
It is, though, quite uncommon.
So if a vet suspects portal hypertension based on the history and the exam, how do they actually go about confirming the diagnosis? It sounds like there are many potential pieces to this puzzle.
You're right. It really involves putting all those pieces together. The pet's history, what you, the owner, have observed at home, the physical exam findings, and then, yes, a range of diagnostic tests.
Okay.
Analyzing any fluid that's collected in the abdomen, the ascites fluid, that's often one of the very first crucial steps. We talked about the protein content giving clues.
Right, the transudate versus modified transudate. And what about blood work and other lab tests? What can they tell you?
Blood work can reveal several important clues. For example, in cases with blood clots, sometimes we see fragmented red blood cells under the microscope. They're called schistocytes.
Schistocytes, okay.
With portosystemic shunting, those bypass routes, the red blood cells might actually be smaller than normal. That's called microcytosis.
Smaller red cells, why is that?
It's thought to be related to altered iron metabolism or transport when the liver is bypassed. We also look at liver enzyme levels, of course, which can indicate liver disease.
Naturally.
And sometimes lower the normal levels of things the liver helps manage, like BUN, blood urea nitrogen, cholesterol, and glucose, can also be suggestive.
Okay.
But what's particularly interesting and quite specific is finding ammonium biurate crystals in the urine.
In the urine?
Yes. Finding those crystals is a pretty strong indicator of portosystemic shunting because it suggests the liver isn't doing its job of processing ammonia properly, so it spills out into the urine in this crystal form.
Wow, so even something relatively simple like a urine sample can offer a really big clue here.
It absolutely can.
What about imaging techniques like x-rays and ultrasounds? How do they fit in?
Imaging plays a vital role, definitely. Chest x-rays are important for looking at the heart and lungs, helping identify those potential heart-related issues that could cause post-hepatic portal hypertension, things like an enlarged heart or fluid around the heart.
Okay.
Abdominal x-rays can confirm the presence of fluid in the abdomen, the ascites, and might show changes in the size or shape of the liver and spleen.
But ultrasound is key, I imagine.
Abdominal ultrasonography is particularly valuable, yes, because it allows us to actually visualize the portal vein itself. We can look directly for things like blood clots or narrowing or evidence of abnormal blood flow.
You can see the shunts.
Often, yes. We can frequently identify those acquired portosystemic shunts. And we can assess the overall texture and appearance of the liver tissue itself using Doppler ultrasound.
That's the color flow one.
Exactly, Doppler color flow. That helps us actually see the direction of blood flow. So we can confirm if blood is indeed flowing hepatofugally away from the liver instead of towards it, which is a key sign.
Makes sense.
An echocardiogram, which is an ultrasound specifically of the heart, is essential for ruling out primary heart conditions as the cause.
Right, checking the post-hepatic possibility.
Precisely. And then, in more complex or confusing cases, we might need advanced imaging like CT scans or angiography, which gives really detailed pictures of the blood vessels.
Okay.
And finally, Often a liver biopsy is crucial. Taking a small sample of liver tissue to examine under a microscope is really the gold standard for diagnosing the specific underlying liver disorder that might be causing or contributing to the portal hypertension.
Right. Getting right to the source within the liver, it sounds like a very thorough investigation is often needed to really pinpoint the exact cause.
It often is because the treatment depends so much on that underlying cause.
Okay, so let's talk about management then. Once a diagnosis of portal hypertension is made, what can actually be done to help these pets?
Well, it's really critical to understand that the most effective management strategy focuses on identifying and addressing the underlying cause of the portal hypertension, whatever that may be.
Treat the cause first.
Exactly. However, providing supportive care to manage the consequences, like the ascites, that's often a key part of the treatment plan too.
And ascites, that fluid buildup in the abdomen, that seems like a really common and uncomfortable issue. How is that typically managed?
Yeah, managing the ascites usually involves a multi-pronged approach. First, restricting sodium in the diet is pretty essential. Less salt, less fluid retention.
Okay, low salt diet.
Then we use medications called diuretics. Often we combine two types, furosemide and spironolactone. They work in slightly different ways to help the body get rid of that excess fluid through urination.
Right, water pills.
Basically, yes. In some cases, if the fluid buildup doesn't respond well to those standard diuretics, there are newer medications like tolvaptan and telmisartan that might be considered.
How do they work?
They have different mechanisms, targeting water channels or blood pressure regulation, but their use specifically in pets with liver disease causing ascites is still kind of an evolving area, not first line, usually. And then, for really severe ascites, if it's causing the pet significant discomfort or even making it hard for them to breathe,
Yeah.
a procedure called therapeutic abdominocentesis might be necessary. That's where the fluid is physically drained from the abdomen using a needle.
Draining the fluid.
Yes, but needs to be done carefully. There are potential complications like protein loss or electrolyte imbalances, so it's usually reserved for severe cases needing immediate relief.
Okay. What about dietary changes or meds for some of the other consequences, like that hepatic encephalopathy, the brain issue?
Right, HE. In cases where that's a concern, sometimes dietary protein restriction is recommended.
Less protein.
Potentially, yes, but only if there's clear evidence that the pet is actually sensitive to the nitrogen waste products from protein breakdown. You don't want to restrict protein unnecessarily,
Why not?
because excessive protein restriction can actually be harmful, leading to muscle loss and malnutrition, especially in animals that are already sick. So it's a careful balancing act.
Got it. What about surgery? You mentioned those acquired shunts. Can they be closed off?
That's a really important point. Surgically trying to tie off those newly formed acquired portosystemic shunts, or doing procedures like placing a band around the vena cava to try and redirect blood flow, those are generally not recommended.
Not recommended. Why?
Because those shunts develop for a reason as an escape route for the high pressure. Closing them off without fixing the underlying cause of the high pressure can actually make the portal hypertension much worse, potentially dangerously so.
Okay, so you can't just block the detours.
Exactly. You have to address the original traffic jam first. Now, in very rare circumstances, surgery might be beneficial if there's a specific surgically correctable underlying cause,
Like what?
like maybe a congenital kink in the vena cava that could be straightened, or a condition called constrictive pericarditis affecting the heart sac.
Right.
But these are uncommon scenarios. And for those liver AV malformations we talked about,
Hmm?
surgical removal often carries a pretty poor prognosis, unfortunately.
I see. So mostly it's about medical management.
For the most part, yes. Ongoing monitoring, managing the complications like ascites and HE, and trying to treat the root cause medically if possible.
Mhm.
Those are really the cornerstones of managing portal hypertension long term.
So it really boils down to identifying and treating that root cause, whatever it is, while carefully managing all these various complications that pop up along the way.
That sums it up well.
It's truly fascinating, though, how interconnected all these bodily systems are and how just a change in pressure in one specific area, the portal vein, can have such widespread, significant effects throughout the body.
Absolutely. And hopefully, understanding these intricate mechanisms can empower you, as a pet owner, to be more observant, to notice subtle changes in your animal's health and maybe seek veterinary attention promptly if you do have any concerns.
Definitely. So to kind of recap our deep dive into portal hypertension in dogs and cats, we've learned it's a complex condition. It can stem from various issues affecting blood flow before the liver, within the liver, or even after the liver.
Right. Prehepatic, hepatic, or posthepatic causes.
And this increased pressure can lead to some serious consequences, like the body forming those abnormal blood vessel detours, the APSS,
The acquired shunts.
fluid accumulating in the abdomen, that's ascites,
Yes.
and even neurological problems, the hepatic encephalopathy.
Oh, correct.
And that early recognition of potential signs, the swollen belly, the weird behavior, the GI upset, and getting a thorough diagnostic workup from your vet, that's really crucial for identifying the underlying cause and figuring out the best way to manage it.
Couldn't agree more. Early diagnosis and appropriate management are key.
So, the next time your pet has maybe a seemingly minor tummy issue or seems a bit off, it certainly gives you a deeper appreciation for the intricate and delicate balance of all those internal systems working away inside them, doesn't it?
It really does. These are complex biological machines.
Hopefully this deep dive has given you a solid foundation for understanding this particular condition. And remember, if you ever have any concerns at all about your own pet's health, please don't hesitate to reach out to your veterinarian. They're your best resource.
Absolutely.
Thank you for joining us for this deep dive into canine and feline portal hypertension.